quite a lengthy one. I've shortened it, excuse me, my trousers feel like that. To saying laser removal of scars. Here we go. This is the question. I have multiple scars on my body, and this has really affected my self-confidence to where I'm coming to the point of considering laser scar removal. My scarring is really dark. I also have significant lesions of hyperpigmentation. My scarring is around my legs, back, right side of stomach. I suffer from mixed connective tissue disease. I see my consultants often, and they have seen my scars. They believe due to meds, my body can get easily bruised, but I don't think they see how it's affecting me. It's almost my whole body is full of scarring and bruising. So this is an interesting question. So the whole thing of scar removal, I feel that this patient felt, well, I feel like I was a bit negative really, because you can't remove scars, so scar removal's not really a thing. You can revise scars, you can make scars better, but you've got to realize that when you're a surgeon, all you do is make scars. So the bottom line for this person who's got scars all over their body, suffers from mixed connective tissue diseases, they've got reasons for hyperpigmentation and scarring, is that I think that if we were to revise them, they go the same way. Now, one question I did ask is, did they have any problems in terms of when they first had the scars, when the scars were fresh and red, did they get in the sun? Because if they got in the sun when the scars were fresh and red, that can cause hyperpigmentation of scars. That can cause scars to go brown. So if there's a reason for the scarring to have a problem, then you're more likely to want to revise it. So if they had gone in the sun, if they hadn't gone in the sun, but if they had and got the scars were brown then it would be possible to size the scars, close the scars and say, don't get in the sun this time, and hopefully that will be better. Similarly, if you get an infection in the scar and if it gets hypertrophic, very red and raised, if it was infected and took a long time to heal, then you think, well, that's a reason for it to get like that. If we can revise it and not have that problem, then there's a good chance we'll get a better scar. So if there is a reason for the scarring to be bad, then we're more likely to want to revise it. If it's just because it's the way your body scars, which is what it sounds like in this case, this patient's got connective tissue disorder and they're on medication, which might makes them easily bruised, then we're not going to be able to change that. So if we can't change that and we just cut out your scars and give you new scars, they're probably going to go the same way. So scar revision is really if they've said they want laser removal of scars. Now, laser is good for specific things. So laser targets certain pigments. So particularly for scars, it can target the red pigment. So it can help with red scars. Now, I have to say, most red scars settle on their own. They may take a year or even 18 months for them to really properly settle, but they usually settle on their own. Now, laser can help that. We don't do laser here at the clinic. Well, I'm not in the clinic, but in the clinic. But laser is good for red scars, but often the redness will settle. It doesn't remove the scars. Nothing can remove the scars. All we can do is change the scars. So if there's a problem with them, if they're dented in, if they're lumpy and raised, if they're in a funny line, if they're in a bad position, we can change the position of the scar. We can maybe help with lumpy scars, maybe help with puckered scars, maybe help with dented scars, but we can't remove them, we can only change them. So I think sometimes sort of cosmetic camouflage makeup and things is the way to go.